Hi there. Have a seat. Get comfortable. I am just about to go over your chart. Can you verify your name for me? Thank you. Yes, I know since you have been coming here, it's been very, probably frustrating for everybody to continuously ask for your name. And we do this for multiple reasons. You will find this in any hospital, in any medical facility like this one, plastic surgeon's office like this one, because we do have multiple patients around. So the nurses are constantly visiting other clients, other patients, potential patients. And over the years, a lot of those patients have lost their patience. No, a little medical humor for you today. You look a little bit nervous. Go ahead and calm down. Shh, 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 shh. It's going to be fine. There are no injections with this procedure. There are no side effects really to this procedure. Nothing. Very good. So, let's just go over your chart here. You've been here before, it looks like, for a Botox procedure, lip augmentation, potential other body modifications and augmentations, but the actual procedures you've had in our office were Botox and lip augmentation. And today, Latisse. So let me just ask you a few questions before we get started. Number one being, have you heard of Latisse before? How have you well, obviously, if you're here, but how have you heard of us? Okay. That's how most people hear about it, either from on the wall over there or Google. Sometimes you notice when speaking on social media, like when your phone's around, talking about eyelash extensions, eyelashes, it pops up for Latisse, so very odd, but that's social media for you. We never know the algorithm. But have any of your medications changed since you have last been seen here? Okay. And if they stay the same, can you verify the dosage for each one, please? Yes, usually any medication taken with Latisse, since it is a liquid, it is absorbed by the skin. It's not really a concerning effect that we look forward to, because since Latisse is relatively new in regards to the plastic surgeon's field, because it is actually used in more of the eye field, so in the optometry world, and I'll explain why. But okay. I know this is personal and this isn't anything, but has your weight changed? We ask this because the dosage of Latisse can potentially be larger or a little bit less. Okay. The reason I ask this isn't anything personal, and I know it can be a little bit touchy, but I do like to let all of my patients know that you don't need this. You do not need Botox. You do not need lip augmentations, body modifications or augmentations. You do not need any of it. I like to tell everybody that they are beautiful just the way they are, whether or not they're here to feel a different way about themselves. I just say these things because I mean them, and they need to be said. I feel that they are not said enough in the plastic surgery community. So, unfortunately, I do have to ask for medical reasons. That's why. So, but it doesn't matter because we are finished with the questions. Unless your height has changed. Okay, very good. So, I do have to ask for consent to touch you before we begin today. I'm going to be doing a few exams. One, I'm not going to be using the stethoscope, but I am going to be taking your blood pressure. And that is where Latisse comes in as to why it was more for the optometry, because patients with glaucoma and other eye conditions used Latisse to reduce swelling in their eyes, which is a potential, actually a very normal and often side effect with those types of unfortunate diseases and issues. I personally have stigmatisms in each eye, and the Latisse, since using it, has helped the swelling. So it has a lot of good effects, but it was mostly known and mostly founded in the optometry field. But one of the side effects of Latisse, many patients have reported all over the world of their eyelashes, eyebrows, and hairs growing around their eyes. And since then, the plastic surgery field has picked it up and used it to their advantage, and the brand itself has used it to their advantage. But blood pressure dictates any potential swelling in the eyes, so we do have to do a very quick eye examination prior to me applying the Latisse and teaching you before you can take it home. So it appears that, let me just see here. Judging by your chart, somebody actually bought this consultation and a full bottle, 5 ml, for you. Is that right? That's incredible. Yeah, Latisse goes for about $300 a bottle. If you have insurance, it's just a little less than that, but I'm going to give you some tips and tricks in regards to how to prolong your solution, whether or not it was paid for you. I like to tell all my patients not to waste. Okay, I'm just going to get your right arm here. Go ahead. Very good. Okay. So, see if that's on your arm correctly. Okay, ready? Very good. Okay. Blood pressure is normal, which I probably could have told you, judging by the examination I'm going to be doing. And I'm also going to be looking at your eyelashes as well. So, I do have to ask, just for medical reasons, what brought you in today to potentially get Latisse? Well, it looks like you're getting it anyway, but okay, because I personally, just by looking at you, I think your eyelashes are beautiful. As somebody who uses Latisse, themselves, I find that I still sometimes wear falsies here and there. But I am going to be touching your eyes throughout this examination. So actually, I am going to save on the gloves because first off, we do need to sterilize your eyes. So I do have this little sterilization pad. I do have this sterilization pad. going to snip, snip. Very good. And what I'm going to do is just go ahead and wipe around the eye area. So if you do have eye makeup on, I do apologize, but I do have to remove it. So if you're uncomfortable going anywhere after this without makeup on one area of the face, I suggest maybe going home and fixing it up. Is that okay? Okay, because again, I personally think that you look very beautiful just the way you are, but let's go ahead and give you a wipe on this side. And on the other side. Very good, okay. Now, as I mentioned earlier about patients who, have that disease, who have reported hair growing in multiple places, it is very important to apply Latisse correctly. Not because of any adverse side effects, but one of those side effects being extra. After applying Latisse, you'll notice a little bit, if you're using too much, rundown on your face. Patients have reported hairs popping out in the line of Latisse that it has made. So we do need to be very careful about that. But now I will be applying the gloves. And first thing I am going to do is a vision test. Very simple. I am going to be using a pen light. And just giving a quick look into your eyes. So, bright light warning. So be very quick. And then I'm going to be using a magnifying glass. And that is just to get super close to your eyelashes in between them to see how long you should be using Latisse and how much Latisse can work for you. So I do have this little hairband I'm just going to be wrapping around and pulling up your hair with so I can have full access to your face, okay? Okay, I'm just going to get a little close to you and wrap this around your neck. Very good. Just pull that up and secure. Excellent. All right. So I am going to be touching around your eyes now. Good. Here we go. Bright light? Maybe not. Batteries are running out on this thing. Here we go. Okay, just very quickly pulling up your eyes, eyelids. Okay. Good, and then just pulling down here on the lids. Just looking down in here very gently. Okay. I don't see any signs of, I hate the word, but eye snot. And the coloring is normal of the little bit that you do have, which is normal production of eye mucus. Other side. Pulling up. Pulling down. Pulling up. Pulling down. And the other. Link up. Pulling down. Pulling up. No, 1 second. Again, this has been giving me just a little trouble, but we're almost done. And pulling down, down, down. Okay. So, a little bit of light change there, but that's completely okay. Alright, so next, I'm just going to be using this magnifying glass to be getting super up close to you, and we might be using the light again, but I just want to get a little close, and I have this little comb here, and I'm just going to be combing through your lashes, okay? It's very tiny. Don't have to fret about me potentially poking your eye. That's why I have this little guy. Well, big guy. But I've, often complimented people whenever they were in fact smaller objects, but that's okay. Okay, ready? Just getting up close here, just combing up, going up. Very good. Okay. Let's see if this light will work for me this time. Abracadabra, bright light. Okay. We're just checking the eye up close. See if there's any abnormalities in the lashes. Okay. And other side. Let's see if I can keep this light going. Just very close here. You're doing very well. No abnormalities in the lashes that I can see. On this side either. So let's go ahead and comb through those to be sure. Stay a little bit of combing here. Combing up. Combing up. Good. Okay. So, other than the application of Latisse, we are pretty much finished with the exam, except for one more, and that is just the sensation examination. I have these two little sticklies, and what I'm going to do with these is I'm going to take the pointy side, and I'm just going to poke gently around the eye, and I want you to tell me when it starts to get just a little bit uncomfortable. Now, of course, I'm not going to make you uncomfortable, but having something sharp pressed up against you, it's good to know what's going on. So just let me know when the poking becomes a little too much, and I'll stop right away. Ready? Just let me know. Nothing? Okay, 1 second. Let's try this again with a little bit more firm pressing. Okay, there we go. Very good. Okay, well, you can take just a little bit more pain than other ones of my patients, but that's completely okay. So now let's get right into the Latisse and what we're going to be doing. You're 100% cleared for application and use. I am going to send you home with a 5 ml bottle and 0.3% of the solution. And this is actually called bimatoprost. A lot of people pronounce it differently. And what this is going to do, again, is grow your eyelashes. Now, judging by everything in your chart, my eye examination results and things of that nature, you're going to be using Latisse for about 6 weeks before you can fully feel confident in the results, okay? And the reason for that is you're only going to be applying it once a day. So, and that is right before bed, so the body can absorb it overnight and allow it to sink in and have those lashes grow. Because we all know that hair grows most when we are asleep. And the body is regenerating itself. So the Latisse box looks like this, and you're probably wondering, what 5 ml bottle is that big that it has to be in a huge box like this? And that is because this comes with multiple applicators. So when you open it up, you'll find your Latisse right here. Very tiny little bottle. And I am going to send you home with 1 application today, although it is not bedtime fully. So these are your applicators, and here is your instructions, which, to be completely honest, you don't really need them. But it just shows you a little bit on how to use them. And it says, before applying each night, make sure your face is clean, remove applicator, draw applicator carefully along the skin base of the upper line. Okay, now I did not mention one of the side effects that could potentially not be enjoyed by many people, and that is if you're putting it too high up on the lash line, what that's going to do is pretty much color of the lash line, like you have some kind of dark translucent eyeliner, if that makes sense. So I'll explain. But let's go ahead and get an applicator. So again, the first thing you want to do before bed is make sure your hands are clean and your eyes around your eyes are clean, okay? And the reason for that is because Latisse also enhances the absorption of the liquid in your eyes, so we don't want any dirt, possible infections. So, number 1, clean and sterile hands and eyes. Number 2, grab your applicator. Now, I don't know if I should be promoting this, but they give you 1 for each eye. I personally, to keep, mine going, I don't waste a lot. I use 1 and save the next for the next night. Let me warn you that using Latisse twice a day does not grow them any faster. I know 6 weeks is a wait, but I can promise you it's worth it. Latisse has been 101% proven to grow your eyelashes thicker, fuller, and especially longer. So just get one of these off. And what we're going to do, my best advice on how to save, because they tell you to put 2 drops on, 1 for each stick, but here's what I do, and I'll show you in a moment, but here's the little bottle. So we're going to take 1 stick. I can also recommend a makeup brush right here. And what this does is it has a little bit softer bristles, so it absorbs a lot less product. Well, actually, a lot more product. But here's the solution. Open that. Get one of our applicators, says lift here. Okay, you can tell the difference between these very thick compared to very soft but dense. Okay, so this doesn't hurt. Maybe for your first time it will burn just a little bit, but nothing where it's going to be uncomfortable. You get used to it right away. Consider it as any other eye drop. You take the cap. Here's my advice. The instructions tell you to drip right onto the applicator. Trust me, instead of 2 drops a night, take 1 drop right into the cap. Okay. And what this is going to do is save you a lot of the product and extend probably up to 2 months more. So you can see it in here. Take the brush, just gently dip the tip in there. You can see the product in it, and I'm going to go ahead and apply. So just close your eyes. And we're just going to brush along the lash line here. Brush. Brush directly along the lash line. Just like that. It's pretty cold, isn't it? I know. Just keep your eyes gently closed. Making sure to get the upper lashes. Now, some people ask, do you want to put it on the bottom lashes as well? If you have any extra product, you can go ahead, but because your eyes are closed when the application is put on, it goes pretty much to everywhere in your eye. And then again. The rest of the remaining product, you can still tell that it is very, very filled up and ready to apply to your eyes. So go ahead and close. There we go. You're doing good. Brushing right along the lash line into your lashes. Right into your lashes, into your lash line. Lashes, lashes. Right, brushing right into your lashes. Okay. Very good. And if you look, there's still a little amount in there. So, are your eyes pretty damp? Here, just go ahead and dab. Dab, dab, dab. And then the other side. Dab, dab, dab. I told you. It saves a whole bunch of products, so you're pretty much extending a 3-month, subscription to a 5-month subscription with 1 drop a day. And just drop it in the cap. Every once in a while, sterilize your cap. That way, you keep dipping different applicators in there. It's always good to just, be safe. Nobody likes pink eye, but that is pretty much it. I'm just going to go ahead and take this little brush here and brush around your eye so absorb any of the product. Dry any teary eyes, which for your first time is expected and not uncommon. Very good. Good. And let me go ahead and pack the rest in your box here. Instructions. Latisse. Right in here. And applicators. Very good. And you, my doll, are ready to go. I'll put this right here with you. Go ahead and remove our gloves. I'm actually going to remove them this way. I have a pet peeve when I remove gloves. I don't want to feel the inside of them on the way out, if that makes sense. I know. But I would like to see you after actually 4 weeks, so about a month. You can schedule with my secretary up front, and the reason for that is because I would like to see how your eyes are taking to the Latisse, and we can judge whether or not you would like to continue it, whether your 6-week trial is up, And let me go ahead and take that hair sticky tie off you. Okay. Good. Excellent. So, I will see you in about a month. If you have any problems, any questions, any concerns, you can call me at my cell number, which my secretary will give you. I like to keep a personal relationship with all of my patients. I never want any of them to feel uncomfortable or just a little off edge. So with that being said, thank you so much for stopping in today. I really believe you're going to enjoy your results. Just because I'm wearing false lashes doesn't mean that underneath I don't have about half the size as how long these lashes are. So you have a good rest of your day. Have a safe drive home, and I'll see you next time. Bye.